Hi everyone, welcome back to our podcast. Today we'll be discussing a topic which affects millions of children, yet it does not receive the attention that it should be receiving, and that's children's oral health. Specifically, today we'll be discussing the Oral Health Report, which is part of the year-long Child of the North series. This series is in collaboration with the NH Research Partnership and the Centre for Young Lives, and it has a strong focus on the inequalities that children face in the north of England. But before we dive deeper into the subject, joining us today is one of the co-leads of the Oral Health Report. Please welcome Dr. Peter Day.
Samaya, thank you very much. It's lovely to be here.
Lovely to meet you too.
So I'm Peter Day. I'm a professor of children's oral health and I'm a paediatric dentist. So I get to work and exclusively with children, providing dental care for them. And I work both in Leeds at the dental hospital, but also work for the community dental service out in Bradford, looking after a wide range of children with additional needs, both dental, medical, social, and educational.
Amazing. Thank you so much for that. And with that, we'll get right into the topic. So just to start off with, what is the main purpose of the Oral Health Report? And why is this report so important for our communities?
It's an opportunity to shine a light on children's oral health. And we know that children living in the north of England have poorer oral health and that there are significant inequalities in that some children have greater levels of disease than other children, even within the north of England.
Of course. And I've also read through the report myself and I find it very insightful. And I came across some kind of statistics based on how it kind of impacts children, etc. So would you like to speak a bit more about that potentially?
Yeah, let me start with just the figures. We know that by the age of 3, so teeth have only been in the mouth for 18 months or so, that 1 in 10 children has obvious decay in their baby teeth. By the age of 5, that figure goes up to 3 in 10. So three children in every 10 have dental decay. And for some children, by the age of 15, half of children in some areas have dental decay in their adult teeth.
Those numbers are honestly shocking. And I think that's probably very different to what the general public, and I know for myself even, it's very shocking. I wouldn't expect the numbers to actually be so high. So I'm assuming that actually emphasises how important this topic is.
Absolutely. It's not only just the numbers, it's the impact that tooth decay has. For example, you can imagine that with tooth decay, you have toothache, pain, disturbed sleep, disrupted eating, and other child development things such as speaking and talking. But it affects also the wider family if you need to take time off work or you're up in the night with your child. And it also affects the health services, not only dental services, but it's the most common reason why a child aged 5 to 9 is admitted to hospital, and that's for dental extractions and a general anaesthetic.
And of course, this is during probably one of the most important times during a child's development. And are there any kind of knock-on effects that you can think of for their development?
Absolutely. So it's a very common reason why children miss school. And obviously school provides the opportunity to learn, to develop, to socialise with your friends. And if you're missing school because of dental reasons, then you're missing out on those opportunities.
Yeah, absolutely. Well, thank you so much for that insight. Based on the evidence that you've shared from the report, what are some of the key recommendations that the report makes?
We have 3 key recommendations and then some themes within them. So the first recommendation was to develop and implement a national child oral health improvement strategy. The second one was to maximise the impact of early years and educational-based preventive oral health programmes. And the third was around reorientating dental services towards prevention of dental disease in children and young people. So if I just expand a little bit around the national plan, it was interesting to see that was a key recommendation in the NHS plan, which came out earlier this week. But we're looking at reducing sugar consumption, for example, by expanding the soft drink industry levy, but also around food marketing, advertising, promotion, and restricting the sales of caffeinated energy drinks to children under 16. And also optimising the exposure of fluoride through a combination of community-based water fluoridation and targeted programs such as the supervised toothbrushing, which is now a national, not only a manifesto pledge, but now a national rollout for children aged 3 to 5 living in the most deprived areas are all going to get the opportunity to take part in supervised toothbrushing in schools in the early years settings. With respect to the school and early years based settings, we're looking at how can we integrate oral health preventive programs across multiple different professionals. So whether that's health visitors having oral health conversations when children are babies and young children, there's supervised toothbrushing and other activities that can happen in a nursery and primary school setting, oral health lessons and other activities in secondary schools that can all help to improve children's oral health. And then finally, with regards to dental services, we're very much looking at optimising and maximising the number of children who can access an NHS dentist. And when they go to a dentist, making sure that they get access to those preventive professional treatments, and also ensuring that those visits are positive and allow the child to develop their confidence in going to the dentist and developing those habits on a regular basis.
Thank you so much for that. That sounds like a very proactive approach. Are there any examples of this taking place currently at the moment, or is this something that we're kind of working towards?
So there's lots of different examples. I mentioned the supervised toothbrushing program. We know that from our last survey, about 150,000 children are taking part in supervised toothbrushing programs, and that was last academic year. More recently, we have a new survey which we'll be publishing the results for this academic year, and as the national program rolls out, we're hoping to move from 150,000 up to 600,000 children accessing this program. And there's strong evidence that it works, it reduces health inequalities, and there is a strong return on investment. So for every £1 spent, there is £3 recovered as a result of that.
Incredible. Well, thank you so much for that. And just before we reach the end of our episode, what's one key message that you'd want our listeners to take away?
I would say please read the report. There are some really interesting, innovative and different projects happening across the north of England, across our dental schools and the wider community. They're inspiring, they're opportunities for our undergraduates to get involved, and they can really help if we implement them at scale to improve children's oral health.
Well, that's such an important message, Peter. Thank you so much for that. And also thank you for all the work that you're doing to help improve children's oral health. And to our listeners, if you'd like to read the full report about children's oral health, then we strongly encourage you to read the full report. You can find it on the N8 research website, but also we'll include a link in the description below if you'd like to read along.